Hi, I'm here with Abby today, who graduated from the BSPS program in May 2020, and she's currently working at Pfizer, where she's involved in many fast-paced oncology projects. Thank you for being here with me today, Abby. I'm really excited.
Thank you for having me.
Of course. Can you tell us a little bit about what you are doing in your career at the moment and how you got there?
Yeah, so I actually started fully working for Pfizer back in June, so just about 4 months now. I came in last year actually as a contractor during COVID, which was actually pretty interesting because no one was here. So there was about like 15 people I was really working closely with instead of a couple hundred, which was pretty cool. So I started a lot on a bunch of COVID projects, and then I slowly moved to a bunch of oncology projects, which are very fast paced, kind of the same speed as the COVID vaccine was produced, so about a year and a half.
Okay.
And these projects I've been working on are first in patient products, which kind of skip a step of clinical trials, go straight to people that are sick instead of healthy patients. So those are projects I've been working on a lot. And I'm in the analytical research and development group, which is a lot of early phase discovery and research compared to late stage products, which are already on the market.
Did you know that that was the kind of area you wanted to go in, like straight after you graduated, or like how did you get there? Is that a long-term goal you had?
It definitely was not something I wanted to do right out of college. A bunch of people in my class said they didn't ever want to do lab work again after taking a couple lab classes, and I was kind of on the same boat as them. A lot of people I feel like went to sales or more of like a desk job. So when I got this job opportunity, I didn't really know much about it, and I was kind of just jumping the gun because it was COVID. I didn't think I was going to even be employed during that time. So I came in here. It was probably about 80% lab work, and I ended up loving it. It's definitely very different from what I did in college. The techniques I learned in college were very basic, and I've learned a lot here in lab work, which I think makes it a little bit more exciting because it's not the same thing I did in college, but definitely not where I would have saw myself a year ago.
Okay, that's really interesting that you still managed to find something you weren't expecting you would enjoy though.
Yeah.
Because I know some people like really don't like the labs, and then some people do, and the people who don't, they've all managed to find like really cool careers from the BSPS program. But as
Right.
you're saying, like there's still lab experiences that we have yet to experience in this program that we might still enjoy. So there's you can still go down that route eventually, even if you don't initially think you might go there.
Right. And I think a lot of the stuff I learned in the BSPS program was very helpful moving in here. But there's so much more you don't ever get exposure to because it's so specific to what I'd be doing day to day.
Yeah, definitely. What would you say your favorite thing about the BSPS program was?
My favorite thing was actually one of the lab classes I took. It was like a formulations lab class where you actually physically got to make capsules and tablets and suppositories. And that's something I don't do here, but it's a lot of the samples that I get in, which is very helpful to like see how they're made in a lab and then be able to process and analyze data with those. So I think that was probably one of the coolest classes, or probably like the simulation pharmacology classes we did.
Yeah,
Even though I don't do any of that at my job right now, it's definitely something that other groups do with our products that we make, which is very cool.
yeah, I like the simulation lab too. I was experiencing that through COVID, so it was slightly different.
Right.
But it was helpful for me to see like the kind of more clinical setting of the drugs, whereas like I'm probably not going to be going into a clinical setting, but it's interesting to have that experience. You can kind of see every stage of the drug. So like you mentioned from that
Right.
formulations lab, and then we get the kind of clinical experience in pharmacology. So the program gives you like every stage of drug development exposure in some like small
Yeah,
way.
it definitely does. And I think that was a huge part of kind of choosing my career path. What did I want to do? Did I be early stage in formulation development, or do I want to be in the clinical side, or do I want to do more data verification on a couple of things here at work? And I think having exposure to everything in the BSPS program was great, kind of deciding where I want to be now.
Yeah, definitely. Were you involved in any internships while you were at URI?
Yes, so I did. Both were in my junior year of college. So I did an internship both semesters. The first one was at Coastal Medical in Providence. So it was behind the scenes of what would go on in a pharmacy, I'd say. So it was a desk job. It was all computerized. Something cool about it is I worked one on one with the PharmD candidate, and a lot of the stuff she would deal with patients, I would kind of go back in my own work and look through patient files, see what medications people were currently on, what kind of medications they need to be on, and why they're not on them. So a lot of the stuff was going through medical records, economic status, socioeconomic status, and kind of dealing with those patients to get them on the right prescription medications they need to be on. And then my second internship was at Rhode's Pharmaceutical, which is in Coventry, Rhode Island. That was all lab-based. I was in the formulation group working on just tablets and capsules. So being like the hardcore like hand labor work was actually really cool to see how I get samples here today. You know, I didn't realize it was a lot more work than I thought it was. So that was actually really cool. And that's kind of what got me this job here, is because I had so much experience hands-on in a formulations lab, it was actually really fun.
Yeah, they're two quite different internships,
Very
but
different.
really cool. How did you like go about finding those? Can you tell us a bit about that process?
Yeah, so the coastal medical internship, I kind of just found a bunch of places. I was doing some Google research and I found a couple places I was interested in, because that's mainly at the time what I wanted to do, no lab work. So I just reached out and they were very, easy and accommodating to my schedule, to kind of make an internship work. And then the other one at Rhodes Pharmaceuticals, a colleague the year before had that internship, and I was kind of talking to him for about the whole summer, like if he really liked it, what was it about, and then he ended up reaching out to his manager and saying that I was available, and it just kind of worked out perfectly.
Nice. So it's definitely about like going and finding things that you think you would see yourself in.
Yeah, and there was a bunch of like resources at school I feel like I could have used and done more, but I had such a weird schedule my last year or two, because I was basically done with all my core classes. All my classes were online, for my business minor. So I had a really free schedule, which helped, which I know a lot of people don't have that their last 2 years.
Yeah, I was
So
going
I
to
was
ask
reaching
you
out.
how you managed to fit that in, because I know that like personally I was just like, oh my gosh, I don't even know like where I'd find the time. But I guess
Yeah.
you can arrange your schedule like by taking online classes. That's like a good idea.
Yeah, I think the biggest part was getting the internship first
Yeah,
and then building my classes around that just to make sure I had enough time to do it.
yeah, definitely. That's good advice. What advice would you give then if you would just someone was looking for an internship? What would you say to them?
I would say take your resume very seriously. I designed my resume back, I want to say my sophomore year, and I didn't really have much to put on it at the time. It was kind of like filler stuff like classwork, volunteer experience. And looking back at that now, it was very good for what I had to put on. But looking back at it now, there was so much more I can put on it. I think taking that seriously is a huge deal, because when I came here, I got so many compliments on my resume, and how thorough it was, even if it was just a page. And I spent a lot of time over the summer with Erin Edmonds kind of going over that and getting ready for my master's program. So I think taking that very seriously. And then that summer right before either you graduate or after graduation, take that whole summer to really just research what you want to do, apply everywhere, talk to people, get a mentor to kind of help you figure out where you want to be. And that I spent my whole summer doing that, and it was definitely worth it.
Yeah, I was going to mention Erin Edmonds because she is amazing at helping us with our resumes, cover letters, personal statements.
Right.
I'm spending so much time with her at the moment because I'm applying to grad school, and she's really, really good at her job. And it's like an invaluable resource if you want help writing a resume, or applying to jobs or grad school. So we have that resource, and it's definitely should be utilized.
Yeah, I think everyone should take advantage of that for sure.
Yes. And if what advice, just generally, would you give for students who are in the BSPS program, maybe they're like freshmen, sophomore years, about maximizing their time at URI and the opportunities available to them?
So I would say I never did any undergrad research, and I feel like that is something I definitely should have done and wanted to do. I just didn't have the time because I did 2 internships. I would say definitely take advantage of undergrad research, doing classes and electives that you want to do that are specific to BSPS. Now, there was a lot of classes I didn't have the opportunity to take because of my schedule. I would have loved to take the cosmetology class that they offered. I would say kind of tailor them to what you want to do. Even if you don't want to, if you don't know, I would say do a broad range to get a good idea of what is out there after.
Yeah, that's exactly what I was doing my past few semesters. I'd been taking like a wide range of professional electives because I wasn't exactly sure where I wanted to specialize. And I enjoyed all the classes, but it gave me a good idea that I didn't want to do small molecule drugs. I wanted to do larger molecule drugs. And then from there, I've kind of established that I really like oncology and cancer research. So that's now the PhD programs I'm applying to. So if you know what you want to do, you can build a niche program. But if you don't, there's so many different classes that can help you find out where you can see yourself being involved in the future.
Of course.
Thank you so much for your time. I really appreciate you talking to me.
Thank you so much.